to the Littleton Board of Health Wednesday, September 8th Zoom meeting. We'll get right onto it, and we have a couple public hearings tonight. So at 7 o'clock, we have a public hearing for 15 Dogwood, and John Boardman is here for variance request.
Good evening. Can you hear me?
Yes.
Good. My name is John Boardman. I'm a registered professional civil engineer out of Sterling, Massachusetts. Here tonight representing the property owners for 15 Dogwood. If you'd like me to share my screen, I can show you the plan and walk you around a little bit.
That'd be great. Thank you, John.
All right. Can you see the plan? I'll be honest with you, I'm more used to using Teams than I am used to using Zoom, but we'll give it a shot here. So if you come up Emerson Drive from down by the beach in the parking area and you take a left onto Dogwood, there's a house on the corner. And then the next house on the left would be 15 Dogwood. It's a small property, about 6,000 square feet, and it has an existing house. Currently, there's a septic tank that comes out of the back of the building into a leach pit. And that system is not functioning well. Yes, sir?
Okay.
So what we're proposing is to replace and repair the system. And in this case, we'll come out of the back of the house in the same location to a new septic tank. From there, we'll go to a pump chamber. The pump chamber will push the effluent up into a Presby bed system with 4 sets of Presby pipes. Because of high groundwater out there and the fact that the ground slopes off down to the sort of bottom right of the screen, we're proposing a block retaining wall with a poly liner. And if you note, the 2 properties up on Emerson that abut this actually have very similar systems that were put in a number of years ago with a similar style block retaining wall. So it seems to be a symptom of the neighborhood. We're asking for, yes? Sorry,
is that uphill on Dogwood, or is that down lower than the existing, than 15?
The houses on Emerson are uphill. There's a house here on the corner, brick. I don't remember if the Erickson's house is brick or not. These are both above our site. And then this Raffi property here continues down, and that house is down on Elm, I think it is, much lower, closer to the lake. And then this property actually to the Plan South Friedman property is not built upon. It's a vacant lot. So.
All right, sorry to interrupt.
No, please. Any questions as we go along, I'm happy to try and do my best to answer.
I love the color on the plan. That's really eye-catching. Go ahead. I'm sorry.
The green came out a little bright. I'll give you that. I've never been an artist. So we're here in front of you because we have a retaining wall and we have fill, and it's within 10 feet of the property line. On this side, it's 3 feet off the property line. On this side, it's 2. So that required us to come to you for 2 different sections of your local bylaw. In addition, we were required to notify the abutters, which we did. And then the third part that we're requesting tonight is, and Jim Gariffi had reminded me of it, that the Mass DEP remedial approval for Presby allows for a 2-foot groundwater offset, which is what we've designed for. But it also requires that the Board of Health give the nod and an okay for that. So that's the third piece of information we're asking for you tonight. That's the long and the short of it. It's a repair. We're doing the best we can. They'll actually end up with a fairly level backyard at the end of the day. Right now it slopes off, so I think it's the best we can do, and allow them to continue using the property. I'd be happy to answer any questions.
Great. Does anybody have any questions for John? Kevin or Dan? I can't see you.
Sorry, I'll jump in, Kevin. 2 quick questions. One, in your letter requesting variance, you listed regulation 23. You're requesting a variance for the 10-day prior or private 10-day notification of abutters. Is that accurate?
No. The regulation is for fill within the property 10 feet of the property line. And then I just included the fact that we need to notify the abutters.
Oh, okay.
So
That's what
the request is for the fill.
Okay,
But
cool.
part of that regulation is what forces me to notify the neighbors.
Yep. No, just double checking. I just wanted to make sure that the request for the variance was for the property line and not for the notification.
Yep.
I don't think I have any other questions, and we'll see if we have any abutters, but thank you.
Okay.
I can't see you, Kevin, if you have your hand up, if you have any questions at all for John.
Yeah, just a couple. What was the perk rate and what's the high groundwater?
The perk rate was actually, we did a sieve analysis, so it came back as a sandy loam, so it essentially comes out as a 30-minute per inch perk. And the estimated seasonal high groundwater was 2 feet.
Do you need a variance for the sieve too?
Yeah, that's what I was going to ask.
No, that's allowable under the Title V. It's not a variance, no. Yeah.
I think you
I'm
might.
sorry. Groundwater was 36 inches.
Kevin, you're right. I think it is. I think
you do need a variance for the sieve.
Yeah, use a sieve instead of a perk.
I do not believe so. I believe it's allowable. It may be under the local upgrade approval, but it certainly wouldn't be considered a variance. So
It's in local regs. Just want to make sure you do it by the book, you know.
No, I agree with you completely. But I don't believe your regulations address sieve analysis.
Unfortunately, our health agent isn't here tonight to clarify that. So, do you guys want to go back to old school and somebody read Jim's comments?
I'll be happy to play as if I'm Jim. All right, I'll start. This is the report from Jim Gareffi. 15 Dogwood. The sewage disposal system for this site would be in failure based on the criteria in Title V. It's likely the existing system is in the groundwater. Soil testing was conducted in preparation for the design of a new system, and the groundwater was too high for a perk test to be conducted. A sieve analysis was conducted to arrive at a perk rate. The site presents the following challenges to the design of a sewage disposal system. The lot is small, has a high seasonal water table, a high perk rate, and the land slopes. The applicant is seeking relief from conducting a perk test due to high groundwater conditions, Title V, a local upgrade approval, a variance from your regulations, that's the BOH regulations in Littleton, to place fill within 10 feet of the lot line, and approval from the board for the use of a retaining wall and barrier to meet the Title V breakout requirements. The applicant also needs approval from the board to utilize a 2-foot groundwater reduction for the leaching area with the use of a Presby system. The DEP approval of the system states the board may grant up to a 2-foot reduction for upgrades. The design presented provides a reasonable solution for the upgrade of the current system on this sloping small lot with a high groundwater table in a neighborhood served by town water. The reduction of the groundwater offset and use of the wall will keep the system fill on the lot served by the proposed system.
So he does know that they use the sieve instead of the perk rate.
Right. It says here the applicant is seeking relief from conducting a perk test. I'm just repeating the second paragraph. So it's.
And then I think he says it's a local upgrade approval in the continuation of that sentence, right?
That is correct.
Okay. So that's not anything that requires a butter notification. So if you need me to change the request form to include that, I certainly can. But I would verbally request that you would approve the use of a sieve analysis in lieu of a perk test, as written in Mr. Gareffi's note.
So we can approve that with on the condition that he gets that in writing, correct?
Yeah, we just want to make sure it's listed so there's no problem down the road. So.
I can have your revised request in about 10 minutes via email. It's the beauty of today's electronic world.
Madam Chair, I'd make a motion to approve.
I'll second.
Any butters?
Right, any butters?
Nobody has their hands up.
Okay. All right, so I have a first and a second. So we'll do a roll call. Kevin Baker,
Kevin Baker, yes.
Gino Fratelloni, you're muted. You're muted, Gino. Gino, you have to unmute.
I'm sorry about that. Gino, yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Zeldin, yes.
and Lisa Flanagan, yes. So John, if you send that to Janet, does that sound right, Janet?
Yep, that's all. You're all set.
I'll email that over in a few minutes. Thank you very much for your time tonight.
Thank you.
Thank you.
So moving right along, we're a little bit early for the 7:15 public hearing on Lot 8 of Croft Commons for a variance request. That looks like it's Daniel Carr.
I think so. I think that's who I was told was coming. Daniel, you're here for?
For Lot 8, Croft Common.
Okay, thank you. Anybody else should I be promoting?
If George Gallagher is here, I'm not sure if he was going to come or not.
Okay, he is here. I'll promote him as well. Oh, he was here. Where'd he go? There he is.
Hi, George Gallagher.
Hey, George, we just have to wait a few more minutes for 7:15, the posted time.
Oh, boy.
All right, I think we're close enough. George, if you want to start off.
Okay, so we had submitted a building permit application, and Jim Gareffi replied that he couldn't approve it because we had one too many rooms in the house. Now the people in Lot 8 at Croft Common, they finished the basement, and they each wanted a office downstairs, the husband and the wife, and that's really what creates the extra room. So what I had originally suggested to Jim was we could just file a deed restriction that would limit it to the maximum of 5 bedrooms unless they upgraded the system. And then he said, well, then he sort of directed me to the board and saying that had to be something approved by you. We've done them in other subdivisions where we had to actually record it before the building department would actually look at the application. So that had been kind of why I had suggested that route.
Okay. So is it construction? Is it constructed already, the house?
It is not.
Okay. And the septic system, is that constructed yet?
It is not.
Okay. All right. Any questions from the board?
Just
Okay.
history. Typically, we'll grant variance if it's one room over the count, not 2, with a deed restriction.
Do you have plans to share?
Yeah.
Okay.
Let's see. On the screen. So this is the basement. So you've got the rec room, you've got a gym, and you've got 2 offices. So that's 4 rooms there. On the second floor, or first floor, you've got the family room, the kitchen, dining room, and study. So that's another 4 rooms. And then we've got on the second floor, we've got 4 bedrooms. So that makes up the 12 rooms.
You go back to the basement shot. Would it help if there was no door to the gym?
I'm sorry?
Would it help if I'm talking to the board actually, would it help, gentlemen, if there's no door to the gym? That would cut down one room down there.
Well, it looks like there's no door to the gym.
It's
No,
down here at the bottom.
Back room. Yeah.
That's the door, isn't it?
Yeah.
I think the solution would be just combining the 2 offices.
May I read Jim's analysis?
Yes, please.
Is that all right with the rest of the board? Okay, thank you. Lot 8 has an approved septic system designed for a 5-bedroom house. In accordance with the definition of a bedroom in Title V, the proposed house can have no more than 11 rooms, including 5 bedrooms. The applicant is proposing to construct a new home which has 12 rooms, including 4 bedrooms. Applying the Title V definition mentioned above, the house would need a septic system designed for 6 bedrooms. Title V allows the board to accept a deed restriction on the property, the purpose of which is to restrict the use of the house, bedrooms in particular, to the number of bedrooms for which the house is designed. The restriction is recorded on the deed for the property to inform anyone owning the home of the use restriction. Since the pandemic, the addition of home office spaces has been common, and accepting a deed restriction for the construction of one extra room in the house seems reasonable as long as the house remains a single-family house with no more than 5 bedrooms.
One extra room meaning 11.
One extra room would be the 12.
Yep.
I think that would set a precedent here if we were to approve that.
So you're allowed 11 rooms with a 5-bedroom septic. We're asking for one more.
Yeah, the problem. Since the pandemic, the addition of a I'm just rereading Jim's section. Since the pandemic, the addition of home office spaces has been common, and accepting a deed restriction for construction of one extra room in the house seems reasonable as long as the house remains a single family house with no more than 5 bedrooms. So it's the body count or bedroom count that seems to be operational here. So the deed restriction is no more than 5 bedrooms.
They're building for 4.
No, the house is built, let me repeat, all right? Lot 8 has an approved septic system designed for a 5-bedroom house. So this is a 5-bedroom house.
It's not, though. It's designed as a 4-bedroom. The system's designed for 5 because they also have to cover the extra rooms that are not bedrooms, which count towards the total piece.
Correct.
So that 4, if it's designed for 4, so I see 2 things. One, it's designed for 4. We could do a deed restriction, limiting it to 4 bedrooms, how the house was originally designed. I would have the question, a lot of the ones we approved for deed restrictions have been existing structures who, again, the classic finishing the basement and creating office space or those kind of things. We're finishing a basement as play space. In this case, we have new construction that has not been built yet and a new septic system which has not been constructed yet. So I guess I'm curious a little bit of how going this route for a brand new construction, which shovels haven't gone to the ground yet, it sounds like, why not just design the system to cover the 6 so that you're full compliance without a deed restriction?
I guess my response would be that the house is actually only designed as 4 bedrooms. So designing a 6-bedroom. Yeah, I mean,
I'm asking the question because you're before us because it will, as designed, it is not in compliance with Title V. So you're coming in with an empty lot, plans for a house, plans for a septic system that is not in compliance. And my question would be, why not just design it so that it is in compliance? If the building owner or the building purchaser has requested additional rooms, then that's a change in spec, that's a change in requirements, that's a change in septic if it's what Title V requires. Only because it's brand new, that piece of this isn't, I'm asking someone who wants to finish their basement to build a whole new system. This is new construction, I think, that is slightly different than someone finishing their basement. George is on.
Madam Chairman, could I have a question?
For Mike?
Yeah, it's according to Jim's report. I just want to get the applicant's engineers and designers on board here. Lot 8 has an approved septic system designed for a 5-bedroom house. So do you have already, as it were, an approved system as described by Mr. Griffey? I mean, it sounds as if you already have taken the step of designing a system for a 5-bedroom house.
excuse me, correct. We do have a 5-bedroom approved sewage disposal plan.
Okay. I just want to make sure that the facts on the ground are here. Okay. Thanks.
And after that design was approved, the new owners requested a change in the house design.
Right, to get that second office.
So typically what we do is we take the total room count, divide by 2 and round down. And that's the size of the septic you need. So
Correct.
if we did that On the 12, it would be it was 6-bedroom septic. Can you get a 6-bedroom septic there?
It's tight. I haven't
They have no room. That's what happened.
found it out, but it is tight on the site. It's it's less than a half an acre site. It's an open space development, so we're limited on area of development.
Yeah, so typically we would approve the 11 rooms, but approving the 12 at this point, I think would set a precedent.
Well, 11 wouldn't need
Right.
approval. It would be by right.
With a deed restriction.
Nope. 11 would be a
Right.
The house can have no more than 11 rooms, including 5 bedrooms.
So just that one additional room that requires the deed restriction.
Is it possible to just make one large office?
We could ask them,
Yeah.
I mean, they were the ones who laid out the basement plan. They just kind of gave us what they were looking for, and we had it drawn by the architect.
Because we've had other people come before us and we wanted to add multiple rooms in the basement, and it would bring them over the room count. So there were suggestions on even just like temporary walls to give people privacy, and bookshelves or something like that, but not a wall. I think they need to do a little bit more planning. You think, gentlemen?
I'll make a motion to continue.
We have a
I'll second it. I'll second that.
Okay, we'll do we'll roll call to continuous. Kevin Baker,
Kevin Baker, yes.
Gino Faralloni,
Okay, Gino, yes.
Dan Kane,
Dan Kane, yes.
Mike Zeldin,
Mike Selden, yes.
Lisa Flanagan, yes. So George, if you could get a little bit more specific on that basement office and the room count. that'd be
Okay.
great. All right, thank you.
All right. Thank you.
All right. We have one more item to discuss. Do we do that now, do you think,
Go
gentlemen?
ahead.
On Wellington?
Did everyone read Jim's email on that?
I can read it if you'd like. This is all I have. So 5 Wellington Road is connected to a shared septic system. 5 houses, and each house is assigned a capacity of 4 bedrooms. In accordance with the definition of a bedroom on Title V, the proposed house can have no more than 9 rooms, including 4 bedrooms. The applicant is proposing to construct a new home, which has 12 rooms. The sketch of the basement isn't very clear, but appears to add 3 rooms, including 4 bedrooms. Oh, no, that was parentheses. So the applicant is proposing to construct a new home, which has 12 rooms, including 4 bedrooms. Applying the Title V definition mentioned above, the house would need a septic system designed for 6 bedrooms. Title V allows the board to accept a deed restriction on the property, the purpose of which is to restrict the use of the house to the number of bedrooms for which the house is designed. The restriction is recorded on the deed for the property to inform anyone owning the home of the use of the restriction. I can't recommend allowing the finishing of the basement and the acceptance of a restriction for the plan provided. I think it has too many rooms. So I think we've come up with this with the other shared system neighborhood with increased flow and maybe not enough capacity. So,
Yep.
So I have to tend to agree with Jim's recommendation. Anybody else?
Agreed.
Agreed.
So would we be allowed to speak to this?
We don't have it on the agenda. We just have a.
Oh, I thought they moved me to 725.
No, this
Discussion.
discussion only. We're just trying to, as it were, let you know that what you're proposing is very preliminary. sketch, and you may want to, as it were, re-examine your plan, maybe come up with a different approach to solution of your client.
Yeah, well, we would be willing to do that. We would eliminate the additional room and just do one finished room in the basement, which would satisfy. Again, we're running into the same thing that a lot of builders are running into with regard to people being stuck in their homes and not having enough space. We also have the project that we're working on is a cluster development, and we really, out of 22 acres, my lots are less than half an acre. And now, so there's not a lot of room to utilize. So unfortunately with the COVID, people are utilizing the space inside the houses. And that's why we're getting a lot of requests as builders for finished basements and offices. And we just don't have any places to put it, so they're looking for recreation in their house. Like our particular client wants a gym and a place for a ping pong table in their basement. Doesn't seem that unreasonable. I get the whole Title V thing and the local regs, but we're not adding bedrooms. So in a way to do this is to do the deed restriction, but we're willing to go to the one room and just make it one room for the finished basement, and they'll just have to work out without a petition.
So 9 total.
Yeah, it would be the 9 total.
Those houses are huge. They need a base. They need more room.
They do. Yeah, well, they do. They're 4 bedrooms. You should come over and take a look at them.
I've driven by them. I've driven down. They're
Yeah.
cramped in. I don't. Yeah.
Listen, they approved me for 6 lots, and I it just would have looked disgusting. And I said, no, I'm only going to do 5. I only wanted to do 5 houses on 22 acres. That's a whole planning board issue. Not something I wanted to do, but it'll look beautiful when I'm done with it. So, but we would like to have the gym also.
I don't think anybody's got a problem with 9 rooms on a 4-bedroom septic.
Okay. All right. So, yeah, we're looking to, so we can get that. I'll just redraw the plan and submit it to the
We'll
board.
have to have an official hearing. Is that correct, Madam Chairman?
Yes.
I think so.
Okay. Yep.
Yeah. So, here's my question. I was not on the agenda tonight, or I was?
No, you were not.
Oh, okay. Okay. So we'd like to be placed on the next meeting if that's possible.
But you can contact Janet.
Okay, great.
We probably won't be. We're not meeting until. I'm hoping the 22nd.
Okay.
Can never tell.
No, I know.
Please don't get your hopes up.
I can't next week.
So the board would be fine in theory with what we proposed if it's one big room in the basement.
I think you should basically stay in conformance with what the regulation and the law requires.
Well, here's the reality, right? I can reconfigure the upstairs, eliminate, like an office or whatever, and then be in total compliance and make sure that the room doesn't fall in the definition of a bedroom, which is 70 square feet. And so, in a perfect world, because of the COVID thing, this is, we're changing bedrooms, so we're not eating up real estate in the bedrooms, so the kids have places for desks.
Yep.
It's a different world. We're getting a lot of requests for this. So, and again, here's the thing: the houses might be big, but if they're wide open, there's no privacy. So, yeah, granted, I agree with you, Lisa, that they're big houses, but if they're wide open, it defeats the purpose of having that petition so you can get some work done. A lot of parents are working from home.
Yeah, it's true.
I'm sure you have an office already, and there's probably offices on your plans.
We have one office, yeah.
Yeah.
But now we have 2 parents that are working from home with 3 kids. So they want to stuff them in the basement. We don't have really much of a yard to work. You've driven down there. There's not a lot of yard space.
Look at Dan's extra room. It's a Chinese screen. So,
All right, well,
extra room.
Yeah.
temporarily.
All right. So I think we can just kind of fool around with the plan a little bit, and we should be able to be in compliance. But as long as the board's okay with us having a finished basement in theory until I come in before my meeting, then that's fine with us. We'll make it work. Because like I said, we are getting requests to do these, finish these basements, so they can stuff the kids downstairs or have some quiet space.
Hmm.
And it's an underutilized space too. I mean, you're paying to heat it and cool it. They'd like to use it. And we can get around it with the deed restriction. That keeps us in, the deed restriction also keeps us in compliance with the regulations. But again, we can reconfigure the rooms a little bit and be in much more compliance with that. So we'll look at the plan and look at the design, and then we'll try to get on for the next meeting if that's possible.
Great.
That's okay. Great.
Yep.
Thank you.
All right. Thank you.
Thank you.
Have a good evening.
Good, have a good night.
Thank you.
All right, so moving on to the 7:30 discussion of the Littleton mask mandate regulation. Does anybody have anything they wanted to discuss?
Do we have is Katrina online to do a brief update if she's got one?
I'm promoting her now. It just takes a couple of seconds
Oh,
here.
thank you. My heart skipped a beat. I forgot that I was hoping that she was going to be here tonight.
I actually don't have anything prepared because I wasn't asked to prepare anything. What questions do you have? And I'll see what I can tell you.
Both.
Go ahead, Mike.
Yeah. From what you've seen of what we use the most, what we use almost exclusively the public released information on both the state website as well as the CDC and also some other trusted sites. What's the estimate vaccine rate, if you happen to have that available, for Littleton at the moment?
The vaccination rate?
Yeah, is it still around 78, 79, or is it going over that?
Yeah, we can go through that. So per last Thursday's DPH report coming off the state website, they had Littleton at 7,163 fully vaccinated people. That's about 73.4% of all of Littleton. There was 565 individuals who are partially vaccinated. That's 5.8%. So we are, I think, 79.2% at least one dose for every resident of any age. And there was around 7.5% of our population who are eligible but not yet vaccinated. Did you get those numbers?
So the 8% is all eligible with at least one dose. Our fully vaccinated or not fully vaccinated eligible population is about 15 point something right now, I believe.
So what I have is, per the state data, 13% of our residents are not eligible for vaccines. And I have 7.5% are eligible but not vaccinated per our data.
For one dose. For at least one dose.
They haven't had any dose per our data.
Right. And for right now.
At least one dose? Is that where you're?
Well, so I just want to make sure we're clear because I've seen that 8% number tossed around a lot. So I just want to make sure we're clear so people can understand. Right now, we are at about 85%, give or take a couple points, of eligible residents who are vaccinated, are fully vaccinated. We're at about 79% of eligible having received at least one dose.
Correct.
And then we are at, for the total population, we're at around 73, give or take a decimal or two.
For fully vaccinated.
To be fully vaccinated.
Correct. Yes.
Okay. So just making sure that makes that 8% number, it wasn't clear. So make sure that we're 8% away from, based on one, which means hopefully
8%
everybody.
Based on one.
So hopefully all those folks who got that first dose, if they're on a 2-dose routine, will get their second dose, and that will bump our numbers up significantly.
Yeah, if we can get that nearly 6% of people who are partially vaccinated in there. And I will say consistently week over week, we have around 40 people move from partially vaccinated into fully vaccinated. So hopefully that continues and increases more quickly. So more people are moving into it or getting vaccinated and moving into that category.
All right, no, awesome.
And just to repeat, if we have the numbers, that would be helpful. The numbers of people who are not vaccinated, and I'm particularly after the age span of this, who are
Here, let me
not,
pull up the slide.
Yeah.
I realized I can share. So hold on one second. Things I'm not prepared for clearly to me. Okay. So this is the last slide as of last Thursday. So you can look at the age groups here.
Right. Okay. So those are percentages, right?
They're the total number and a percentage, yes.
Right. So, but the number, I'm trying to get it revealed, the number of people in the 0 to 11 age group, the grade group?
Yep. I can pull that up for you. I think it's just over 1,200 individuals.
1,200 individuals. Okay.
Now I got to stop sharing because I'm moving things around on myself.
1,200. Okay.
1,200.
Wonderful.
Yeah, I can look it up. It
Okay.
is 1,264 according to the state data.
Right. So this is a mixed age group. Obviously, some are in school and some necessarily not ready for school.
Yeah, they're
So,
just
right,
preschool.
Right. And just to make a connection with other real world things, the opportunities for them, for their parents or guardians to give permission for them to be vaccinated is approximately sometime, shall we say, be generous, between December and February.
That is the time frame that I have last heard of. Yes.
Yeah.
That's for when the data should be submitted too. So it might be being generous is correct, Mike.
Well, yeah, the FDA has been through this before, so they know what to, but setting the dose on this is really hard. Okay.
Okay, so I think that's, I really appreciate your information, Katrina, but I'm not sure if this is kind of like a COVID update with the mask mandate regulation discussion. So just want to stay on track too. So thank you.
Answering questions.
Yep. Anybody else have any questions for Katrina?
So we know where we are with vaccinations. We're making great progress. We are, my last look at our county-wide data, we're about a third of the way down the list for vaccination rates for Middlesex County. Again, give or take a position or two. So we are making great progress. We're about 8 or 9 percentage points, I think, above the Middlesex County average. So again, we're doing great. We're closing those holes in our Swiss cheese. We love it. How are we doing since our last meeting? We've had a set of data come out for our case counts. It came out last Thursday. I believe our case count was 30, which gave us an average daily rate of 22 per 100,000 as our normalized measure, which is pretty high. That puts us about a quarter of the way down, about 1/4 of the way down on the Middlesex County list. So we're in the top quarter of Middlesex County for infection rate, or for case count, per normalized per population, despite having a pretty good vaccination rate. So we're going the wrong direction. So at our last meeting, we had 17 cases. We were up to 30. We went from 12.4 daily cases per 100,000 to 22, again, give or take a decimal point or two. So our trend line is still going in the wrong direction. Unfortunately, does that sound accurate, Katrina, from your numbers? Is that okay?
Yes, you have recited exactly my numbers.
Okay, sorry.
That's good.
I always love someone double checking my math. My 3 a.m. nurse rules of somebody always check my math.
I like double checks too, so that's completely fine with me.
Okay, so certainly as we're looking at our standard mitigation strategies are the same as we've been: vaccinate, vaccinate, vaccinate. If you've gotten your first dose and haven't gotten your second, as soon as your time, get it. Distance when you can. Mask up every place that you're out there in public and could potentially either contract or share your viruses with somebody else, hand hygiene, and quarantine if you're symptomatic, and all those good pieces, which, you know, I think we are sending the message out there. I think people are hearing it. We're back to public health practice of how do we get the buy-in. The messages are out there. The reg certainly is out there, with some folks very, very happy and glad that that structure is there. Lots of other folks are less enthusiastic, we'll say, about the mandate, but certainly I think we've closed all the loops, all the holes in the cheese we can without getting much more interventional, much more aggressive infection control procedures, which I don't think we're there yet, thank goodness. Looking at the trend lines, our curve looks pretty similar to what it looked like as far as case rates, hospitalization statewide, as it did last end of October, beginning of November. Ballparky, our numbers look pretty similar. The trend line, the curve on it looks pretty similar for case rates.
The case rates, yes. The hospitalizations and the deaths are not looking like last year, which is
the
fabulous.
hospitalizations are pretty good. The deaths have dropped through the floor. We are still having about 10 or 12 deaths, 10 to 15 deaths per day, which is significant, but certainly much better than where we were. Hospitalizations, we're at a little over 600 right now, which is about the ballpark where we were early November last year, which is a big number for all those folks who go 600 patients in Massachusetts. There's a lot of hospitals. I always love putting these big numbers in some kind of perspective. 600 patients in Massachusetts would mean every single bed at Leahy Clinic in Burlington, every single bed at Emerson, and every single bed at Neshoba were all occupied with nothing but COVID patients. Again, give or take a bed or two. But it's trying to put what that number looks like in practice, what kind of impact hospitalizations have on patient care for everybody, from car accidents to twisted ankles to croup at 3 a.m. to COVID. That's a huge impact on the entire healthcare system. We're certainly nowhere near where we were last year, but the impact is there. I'll do the anecdotal that the hospitals I work at, we're feeling the bed loss significantly. So when you come in with something non-COVID, you are getting affected by all those COVIDs because the volume is such that it's tight. So how can we, do we have any other ideas or suggestions or messaging pieces that we can get as a board or as a town to help reinforce the importance of all those slices: vaccines, masks, hygiene, distancing when you can, quarantining when you're sick, those pieces, so that we can make sure that this curve flattens out at the 30 we're at right now, cases, and doesn't keep following this trend. Because we've gone from end of July, we had an asterisk, I believe, less than 5 cases. And over the course of the last 7 or 8 weeks, we've gone from basically no cases to being 30. And our preliminary numbers are not out there yet. Looks like we're going to have to be going up slightly this on Thursday when the numbers come out. So our trend line is still not going the right way.
Sorry to interrupt you, Dan. Kevin had his hand raised too. Did you want to say something, Dan?
I was just wondering if we knew the age demographics of the hospitalizations.
I don't think they put that out publicly.
They don't? Okay.
It is on there. It's back on there, Dan.
Yeah.
The state took it down in June, but it's back on there. Hold on. So this is if I may, the COVID dashboard, the DPH COVID dashboard. There is now, I'm going to get there so you can see it. Give me a second. Assuming you're seeing my screen. There's now a tab for patient demographics. If you go by age, here are the rates. Just as we've been used to, you can see them going up by age. The risk increases by age. And then if you want just sheer number of individuals, this is the period of August 15th to August 28th. This gets updated every Thursday. So this is that end of August period. So there's individuals in every age group who have been hospitalized, but the majority, I have noticed this middle group has been increasing over the last earlier this month anyway. I don't know if it's still increasing. I haven't looked recently. So if you ever want to find that data, it is now back on the state dashboard.
Thank you.
So, Dan, it was interesting that you should say something about, I heard on the news the other day that hospital or just healthcare people in Indiana are recommending people not do anything risky to actually have accidents that they might end up in the hospital for, because the hospitals are full of COVID patients. So don't ride your bike, don't mountain climb, you know, don't parachute. So I think that was kind of interesting too. We talked a little bit Monday, and Katrina, that you were there. We were talking about that age group that's not really vaccinated, about possibly doing the Vax Bus during Oktoberfest, which I'm not sure of the date, but that
that's October 2nd, I believe.
Okay, that they thought that that might be a good way to get more folks vaccinated in town, that age group that is not being vaccinated. Not sure about if we were talking about doing football games or something like that. I don't think it was really, nobody really came up with anything. I mean, suggestions.
I think there is idea of like visibility and signage and things like that, just to spread the word at football games and whatnot. But I don't think they're planning to bring the Vax Bus or a vaccine clinic
to the football games. Yeah, but I think Anthony requested it for the Oktoberfest. So
yeah.
When Dan, you're talking about what other things we can do.
Yeah, no, that's awesome. And that target demographic is one of the places where we really need to address, which is, as we look from hospitalizations, it's a perfect spot. And nothing quite like a jab and a beer. I'm not sure if we can do it.
Not allowed in Massachusetts because Chief Kennard said that there's a happy hour rule, so we can't do that.
Okay.
The Elder and Human Services is also doing some outreach just to make sure that the our senior population is well cared for and doesn't need an assistance getting vaccines. So I think we're going to start this week.
Yeah, and Jim also forwarded a link of places that people can get their vaccinations and COVID testing too. So I think they were going to put that up somewhere, maybe on the website or something like that. So I can double check. All right. Any other discussion about the mask mandate regulation? Okay. So we'll move on to administrative matters. And the correspondence that we've received has been significant. For the past 2 days, I've had to work. I have not honestly been able to read many of them. So anybody that we can't read all of them tonight, I would assume. Janet, Dan, anybody have a suggestion for correspondence?
We should just go through and respond.
Well, that was another thing. I'm going to meet with Diane tomorrow, and I think Kevin, she said that 7:30 would be good for her if you want to join us on the phone.
Okay.
I'm going to meet with the town clerk, Diane Corey, and we are going to draft a response that will answer a lot of questions for people that might have. So instead of answering each individual correspondence, we can make one response because a lot of the same questions are being asked. Where are we getting our data and things like that? So I'll work on that tomorrow with Diane. And so I don't know if we want to respond to every single correspondence that we've received. I haven't had a chance to read them. We haven't had a chance to discuss it. And I'd like to get a response, an official response from us so that we can give, say it once, hopefully, and then to the people that are asking the same questions. It's up to you guys. What do you think?
Then for the questions that fall outside of that boilerplate information, we can respond individually.
Okay. If you want to, I know I got letters at quarter of, and I'm not prepared to, I haven't read them. I honestly have. I worked 12 hours on Tuesday and 8 hours today with a meeting at lunch yesterday. So I have not had time to read many of the correspondence. So
Understandable.
I have a job. So, and this is my volunteer. So decide what you'd like to do. Go ahead, Dan.
Two quick things if we can. One, I hate throwing more work at Janet. But as the keeper of the email to the board, I've talked to a bunch of folks who have expressed concern that they did not get, if not necessarily a content response, a simple acknowledgement that their email or their letter was received. Is there any way that you can just basically, do we have received the board, and Janet Fairchild on behalf of the board has received this correspondence, thank you, or something, just so that folks know that it's not lost in the ether of email, which sometimes happens to the best of us. I think that would probably be helpful for a lot of folks, just to acknowledge that it's been received. I would ask for, on behalf of Janet and everyone, that for those who don't know, Janet is basically the only staff in Town Hall for the Board of Health. She is the office coordinator for the entire building department, as well as being the administrative support person for both the zoning board as well as the Board of Health. So I know certainly from the emails that I've seen, texts I've received directly, as well as the ones that have gone to the board in general, that there is certainly a lot of passion around this issue. I would ask, if you can, that even as passionate as you are about the issue, please be kind to Janet. She is, at least, she's the paid employee. She's in the middle. It is not her fault. It is not her order. She is supporting the town and she's supporting us. So just please keep that in mind. If folks are passionate about their responses, feel free to share them. We have no problem hearing them, but just please be kind to Janet in the process. If she answers the phone in town hall, I would ask everyone to please be kind. It's a hard enough job, and we have asked a lot of her in the last week, and just please be thoughtful. We are all of us, all the members of the board, I think I can speak for, are trying to do our best to do what's right for everyone in the middle of a challenging situation that, truthfully, no one here alive has lived through before. The nearest thing we had was 1918, and that none of us were here for that. We are doing our best day by day with what we've got for information and guidance from everywhere, state, DESE, CDC, WHO. We're doing our best. So I can certainly ask to please be kind with us, but you don't need to be, but please be kind to Janet. She's working really, really hard.
And here, I was going to say, I was getting to that when I had my member comments. Janet and the building department and town hall scrambled last week, and they did a great job. So, Janet, we all appreciate everything you've done for us. So thank you.
Thank you very much.
Well said. Okay. This is a discussion about the mandate. Do we have anything else that we want to talk about? Actually, no, we went to correspondence. Sorry. And actually, I asked you. There was a correspondence from Mike Prue about the
mask use and the potential challenges or issues around mask use. So one, I appreciate anything you have out there. Anybody who's listening and has meaningful information to share. You have findings, you have studies, you have case reports that are significant. I'm happy to read them. I spent 8 years as a college professor. I'm a peer reviewer for a number of journals. I love reading articles and reading studies. I just enjoy it. And we've been told over and over again, follow the science, follow the science, follow the science. And that's what we're trying to do. We've also, of course, been told that we're not the experts and follow the guidance of others. We are trying to find that balance. So I certainly have read all the correspondence up until about 5:30 this evening. Anything after that, I admit I did not read, but I will get to tonight or tomorrow. We've gotten a number of articles. So Mike Prue actually had shared one and had asked for some feedback. I have not provided it directly to him yet, but it did raise some good questions around mask use. And as a peer reviewer for articles, it certainly brought up some of those questions when you read an article of what is the intent, what is the goal, what's the hypothesis, and are they able to support it. So it's always a challenge. Masks mean lots of different things about lots of different people. So that article, while a lot of the data was accurate, there were some citations that probably warranted further investigation or clarification from the original authors. A lot of the concerns that were raised with masks really weren't with masks, they were with what's called respirators, those N95s, which are, again, defined as respirators as opposed to masks, because they actually block out down to virus level particles. It's what a provider would use for protection from COVID, tuberculosis. It's a tight seal. It's basically the equivalent of near equivalent of putting on self-contained breathing apparatus. It isolates it and protects the user from everything around them pretty much. So some of the downsides, some of the concerns that were raised in the article and then generalized to all masks, we're really looking at N95 challenges. Increased dead space, which as a respiratory tool, basically it's the part of your respiratory system that does not exchange oxygen. Your mouth, your trachea, your main airways. Oxygen doesn't move back and forth, it just travels through. It does increase dead space, one of the concerns. It does trap moisture, one of the concerns. So a lot of the concerns that were raised in the article are perfectly valid and accurate, but really looking at something that we're not asking any civilian, any member of the public to wear unless they choose to. So that's always one of those challenges when you're looking at any article, is it answering the question that's being asked? And there's not a lot. Most of the ones in the article listed for surgical type masks, kind of the standard paper ones you'd see, or basic cone masks or cloth masks, a lot of the concerns were not really applicable to those types of masks as opposed to N95s, those higher level true filtration protective masks, high level protection masks. So one, I want Mike to know that I absolutely read the article. I thought it was interesting on multiple levels, not the least of which is as a reviewer looking at citations and seeing how the data matched up. But again, looking at that, what the hypothesis of, what the argument that they were trying to make, that we think this, and here's our proof that, unfortunately wasn't really applicable for where we are with our mask mandate. Certainly warrant further investigation. Again, we have not done this here in the United States in a very, very long time, having this level of masking. Other cultures, other places have commonly used this level of masking. And a lot of those findings that were in the article have not been seen in those other places. So again, we want to find that balance. We recognize that there are personal choice challenges. There are, does it work or doesn't it? Are there risks associated with it? We hear it, we understand it, and we're doing the best we can. We want, just like all of them, every place, everywhere. The 77 communities in Massachusetts right now who have mask mandates are doing the same thing and trying to figure out what is the best choices to accomplish all the goals we're being asked to. So we're reading it. We really are. We're trying.
Great. Thanks, Dan. I'm really lucky to have you on this board, both of you guys, all of you guys. So, all right. Kevin, did you have a correspondence that you specifically wanted to reply to, or?
I had replied to Ms.
If it was
Carlson.
that letter, can we wait? Was she asking the same things as the first respondent, or the one that?
No, Ms. Carlson was concerned about the mask wearing for singers and vocalists and performers.
Oh, okay.
I had responded to the entire board just for approval of the.
Okay. Yeah, I haven't read it yet. I haven't gotten that yet. So we'll table that if that's all right. But thank you for doing that. All right. Any other discussion on the correspondence?
I don't know if I'm speaking for the board. I hope I am. I really appreciate the fact that the public, regardless of what is written, is taking an interest in measures about which all of us have concerned. And I hope all of us are keeping in mind that we do have a rather sizable number of folks in town who simply can't get vaccinated, even if they quote their parents or they wanted to. And I don't consider, I hope when you do ask questions or raise issues about the masking that you keep those folks in mind. Masking is not just simply something to protect you, it's also to protect others. And there is a community obligation here, whether it's written into law or not. It is, by the way, characteristic of Littleton, I'd like to believe, in view of the fact of our high vaccine rate. And I think that same spirit will drive the rate high enough so that we can get out of mandates as soon as possible, if not sooner. I look forward to that time when we say enough. The other thing I would like people to start thinking about, and I'd like to get suggestions from the community at large, and this is maybe just for me, but haven't discussed it with my colleagues, is that it is very likely that in one form or another, we're going to be living with COVID and it's the virus and the disease it causes for some time. It may not be an emergency or necessarily a high level where we're talking about masking, or that it'll be just enough to keep our attention. I don't know what level that will be. So I think it's time for us to start thinking about what are we really prepared to live with, to endure. I think that's the word. Is classically, it was used in 1918, I believe. What is it? At what level do we decide that this is where we want to be? It's partly a public health issue, but it's also a personal issue and also a community issue. So at some point, it would be useful, it would be very useful to have some working notion of what kind of a world we would like to have, given the fact that we were going to have COVID around at some level X. What's our toleration? And again, I want to express my appreciation to the community at large for submitting their letters. And for those of you who have opinions or have points of view, good or bad, approved or not, please take the time and let us know, because we're only seeing, I think, a small portion of the population responding to the mandate. And I'm very interested in what parents who have kids in the school system, parents of kids who need to have special needs. I'd like to make sure that they get heard along with everyone else who writes in. Again, thank you to the community for contributing.
Okay, great, thank you. Anybody else want to make a comment? Dino, Kevin, good? Okay, so we'll move on to member comments. Thank you, gentlemen. I don't know if they're on. I had asked Park and Rec, Tim, or is there anybody from Park and Rec on?
No.
I'm not seeing anyone.
Well, I just wanted to, Alicia's on vacation. There had been an outbreak at the Explorers a few weeks ago, and I just wanted to kind of clarify some things. It was my apologies that I will take responsibility that I did not. I got emails from them over the weekend between Jim and I, and the Park and Rec staff did a great job doing their own contact tracing and getting the situation under control. It was over a weekend, and usually we do like to have the emails go through Janet just so that they are transparent and everybody gets them. But I did not do that. So, but they did a great job mitigating everything and getting people informed. And I wanted them to come tonight, and I thought they were, but they were going to come and explain what they did. But they spent the whole weekend contacting people and making sure everybody knew what the status was. So if they show up at all during the night, if you can have them tell their story. So okay.
I did have one comment just in regards to the contact tracing you just mentioned. If we could encourage folks to enable the mass notify on their smartphone, I think that if we can put some educational piece out there, that might be really helpful for our contact tracing efforts.
Maybe at our next meeting, Kevin, we can officially have a COVID update with Katrina. I think that would, I mean, we should anyway in 2 weeks with Katrina and maybe Kevin Davis, so we can talk a little bit more about that.
Okay.
So, and then answer your phones too, people, because that is how they find out. You know, don't ignore those phone calls from contact tracing. So, any other member comments? Go ahead, Dan.
All right, thank you. I had a couple long conversations with folks in town over the weekend, as well as a number of folks. And one of the concerns that were expressed was the impact on businesses with the mask mandate. We are not blind or deaf to those concerns. We certainly heard it individually. We've certainly seen it in our correspondence of late. I would say that we hear it, we understand it, that we are trying to find that balance between public health, public safety, and minimizing the impact the best we can. Some things we can, some things we can't. I would ask, after talking to, a member of the community who argued vehemently that the mask mandate was hurting businesses, also then went on and say that they would not shop here in town because of the mandate, rather than going, Board of Health, I disagree with your choice of doing this, so I'm going to make sure that our friends, neighbors, and businesses are supported, and I'm going to be inconvenienced. I'm going to wear the mask, but I'm going to make sure I spend my time and my money here in town. I would ask that it is the COVID and is not anyone's fault. It is what it is. We're all living with it. That the mask mandate is following CDC recommendations of how do we keep this under control the best we can, so that we're back to where we were this summer with basically be thoughtful, be smart. If you're sick, stay home. And that was the extent of our actions. That if you can, please be inconvenienced if you consider wearing a mask an inconvenience, but shop in Littleton, support our businesses, support our restaurants. That, if the concern is supporting our businesses, then please support our businesses. And we hear it, we recognize it, we know that for some population it's hard, but if you can help get us the same way we're trying to help get us health-wise through this uptick in COVID, be a good neighbor and help our businesses as well get through this uptick in COVID and the challenges they're facing. I think that's all I have. Thank you.
All right. Well said. Thank you, Dan.
Yeah, well said.
Well said.
Mike or Gino, any comments?
I concur with Dan. Thank you, Dan. We have to be nice to our businesses here in Littleton.
Mike, any comments?
Nope, it's all been said very eloquently.
Okay, thanks. So now we'll open up to public comments. And again, we would like to have a very civil discussion tonight, where there are correspondence that need to be addressed and we have just not had time for. So please be patient with us. We will get to you. I would like to impose a 2-minute time limit for the public comments. Is that fair?
Yeah.
Okay. Anybody have their hands up?
No hands are raised. Oh, here they are. Okay. Wendy Rosenblum.
Hi, my name is Wendy Rosenblum, 79 Shepherd Road, and I just wanted to thank the board. I don't envy being in any of your shoes, and I appreciate you using the science and the data to make these really hard decisions and keep our kids safe. As the mother of a middle schooler who is not eligible to be vaccinated, I appreciate doing everything the community can to keep kids safe, especially as there's been a positive case in the middle school reported today that I imagine we'll be talking about in upcoming meetings. So I appreciate adding the extra layers in the community to help keep everyone safe, both outside the schools, while the Department of Ed has finally stepped in to keep masking in place in the schools. And just wanted to say thank you for making the hard decisions and doing everything we can to get back to a place that we were in the summer. So thank you.
Thank you, Wendy.
Ina Landsman.
Hi, Ina Landsman, 27 Lawrence Street. I just want to echo what the previous person said. I have both a child who's too young to be vaccinated and a middle schooler. So we're really concerned about COVID. We really don't want our young child to get it, given what we're seeing from states in the South, because some kids do have quite serious long-term symptoms from it. So I'm really grateful that this board followed the science and that you found a good balance to get us through this pandemic, and to hopefully keep our numbers down so we can keep our schools open, so our kids don't have to spend a lot of time in quarantine, but can be where we want them to be, which is school. And what I can tell you is we've been really careful before the mandate, and now we feel more comfortable going into stores in Littleton. So at least from our perspective, I think this may actually help some businesses. And certainly there are a lot of towns and cities that have mask mandates now. And I think a lot of people are looking for businesses with mask mandates. So that's a long way of saying thank you very much for what you've done.
Thank you.
Thank you, Ina.
Justin?
Justin McCarthy.
Justin, are you all set?
He's on mute.
Justin?
Justin Keene, 56 Shaker Lane. Can you hear me?
Yes.
Okay, thanks. Sorry about that. I wanted to just say thank you to the Board of Health for your work here. And this is clearly a very difficult job for us all. To Mr. Zeldin's point a couple of minutes ago of starting to think through the phase when COVID becomes endemic. I think a business like ours, a gym, which had strength and conditioning, has a pretty pivotal role to play in outcome mitigation. We know that exercise can be a very, very powerful way to combat the constellation of symptoms of metabolic syndrome that we know affect COVID outcomes. So I'd like to throw that out there, and I would just like to ask for some clarification. I had sent some correspondence on how to ask for, how can I get you guys to look at our facility the way that we are able to ventilate and distance and choreograph our entire roster of services, and get some feedback on that. And I just would like to ask for clarification on the exact process so that I know how to do this.
Right, Justin, I think we received your letter in the past 2 days. We've received probably about 25 at least. So we will, I think we have 10 days to reply. So we just need to get, more information, but Mike has his hand up too.
Justin, I've taken an interest because I look at places like gyms, anywhere that basically has to do with health, public health as being a big positive in town and for our mission. I've asked our health officer to begin, he's already looking and getting, has probed the state to get some ideas, not some ideas, but what they have defined as outdoors, for example, for certain, shall we say, architectural, you may be able to use your space not differently, but your space may qualify as, quote, a semi-outdoor setting. And we're trying to, as it were, get from the state some set of criteria that they used before for what we'll call places that had 3 walls. So we're trying to, as it were, looking at that. And the second, which is a little bit more difficult, is how can we use some businesses, including gym owners and training folks, have begun the process of asking explicitly for proof of vaccination. I don't want to start throwing more responsibility on gyms to do this. It has to be obviously voluntary, and all the rest of it's taken, because I certainly don't want to start forcing people to take on more stuff. We're also working with the state, and I've also put in inquiries into the CDC through my contacts to see if they've faced this kind of thing before, and the answer is yes. However, I have to wait and see what the information is specifically and how we can integrate it into the way Littleton operates, as opposed to, let's say, California, Colorado, or somewhere else. So I just want to know that your letter has gotten attention, and it's going to take a little bit longer than 2 or 3 days to have the information come back. The thing I'm interested in is the vaccination, is vaccines, and so I'm maybe spending a lot of time on how to leverage that as a way to, as it were, get people to maintain their health.
Appreciate that.
Great, thanks, Mike. The other thing too is, Katrina, maybe you can remind me what we talked about with Commissioner Mullins' department and talking about ventilation or testing ventilation. I don't know if Katrina's still there. I'll have to review it.
I think Ed mentioned something at your last meeting.
Up the COVID.
But I don't have details on what that would entail. I haven't seen those myself.
Yeah, okay. We can also bring this to Commissioner Mullen too, Mike, and see if he take a look at the ventilation and see if that helps too. So we're not taking this lightly, folks. We know that this was a big step and this is a big deal, and we are consciously trying to do the best we can. So, okay, next, anybody else with their hands raised?
Sebastian, you can unmute yourself.
Yes, hi, this is Sebastian Klein from 2 Dogwood Road. So the Shaker Lane School is requiring all of the student body to be masks, including students that are younger than age 5. However, the DESI guidelines only specify or mandate that age 5 and above should be masked or has to be masked, while under that age, it's strongly recommended, but optional. So in that case, I was told that it's based on your mandate that supersedes the DESI guidelines. So I'm just curious to learn a little bit more about the data or the evidence or the rationale that was used to, in that case, not exactly follow the DESI guidelines, because I do have some concerns around masking children as young as 3 years old.
Mike, you wanted to respond to that?
Yeah, I can help a little bit. If you look at item number 9 on the Board of Health mandate, it basically states that the mandate does not supersede or overtake or replace the DESI regulation for masking for schools. So the DESI thing is operational in our schools. So I'm not quite sure where you got the information that somehow or other our mandate basically overrides it. It does not. If you look at I think it's number 9 on our list, on the list of specific items in our mandate.
Yeah, I read that and was a little bit confused by it.
No, it's yeah. I understand why you're confused, because it says one thing, I think, in the second or third item, and then it basically says nope. If it's DESI, it doesn't count. So that's operational. Number 9 is the one that matters.
Okay, thank you. That's good to know. So I guess I'll do my digging somewhere else, given that the school has made that decision. I don't know if it was the superintendent or how and when that decision was made.
That's a different thing entirely. If the school starts messing around with the DESI thing, that's their thing. So I'm sorry.
All right. Thank you, Mike. Dan, you had a comment.
I just had a question. Sebastian just popped off, but maybe we can touch base with Superintendent Kletchy and the school committee. That for under 5, I'm wondering, just is that student a very young kindergartner, or is it, a different? Is it a non-DESI program? Is it under
preschool?
So is it under early education and care? Is it under DEEC, as opposed to DESI? That would be my only question, is that if it's under them, then it's not a DESI guideline. It would fall back to the Board of Health piece. And that's, I'm just not sure how Superintendent Kletchy and his team that preschool falls under DESI rules, or since it's not K through 12 education, if it's preschool, if it falls under DEEC, and that just we need to double check with Superintendent Clenchey and the school committee to see where that falls, because it is true that the DESI rules cover the schools, and that as again trying to allow the school committee, their scope of authority while still trying to balance the town, is how that landed there, and it is certainly potentially confusing. We understand that for Sebastian, of where that confusion can be there, as well as for the school folks and for the principal. But that would be my question. Just we can work with where they fall. Is it DESI or is it DEC? And that would make a difference as far as applicability of the regulation.
Quick question specifically: is it one child or is it the class? Is it a high risk child or? Go ahead, Sebastian.
In that case, it's a preschooler who just started in preschool and
A specific child with
a specific. Well, yeah, it's my son who was required. They put a mask on him while we sent him in without one, but I believe it applies to the entire. I heard from the school that it's a requirement that they've decided on that applies to all students within the school. So regardless of class, I mean, it's age 5 and under.
Mm-hmm. Yeah, probably. Yeah. Okay. Anyone else?
You have no other hands raised in the audience.
Okay. So we'll move on. Janet did not have time to do the minutes because we had such a long meeting last week, and she was being the admin and holding the time clock up. So we'll do minutes next time. So I would just like to, one quick brief statement is wear your mask, Littleton, and eat and shop local. That's my, support those businesses.
We are supporting.
And if you're not vaccinated, please get vaccinated.
That too, yeah.
Don't only get one vaccination, get 2 vaccinations.
No.
If it's a 2-parter, get 2.
Yes.
Yeah. All right.
I'll make a motion to adjourn.
I second.
Great. We'll do a roll call. Kevin Baker.
Kevin Baker, yes.
Gino Fratelloni.
Yes.
Dan Kane.
Dan Kane, yes.
Mike Zeldin.
Mike Zeldin, yes.
And Lisa Flanagan, yes. All right.
I'll
Thank
see
you,
you
everybody.
Thank you.